Hi, Assalamualaikum and a very good afternoon. My name is Aina Batrisha bint Abdul Rashid. So I would like to ask you guys something, which is, do you guys ever face some problems when you want to sleep or often get nightmare? Or feel anxious whenever you close your eyes? Often stay awake during the night? If no, then I guess you all here get a good sleep every night. Ladies and gentlemen, so today I would like to give a talk about somniphobia. Do you guys ever know what is somniphobia? Somniphobia is sleep anxious or sleep disorder. What is somniphobia? The somniphobia is this. Okay, somniphobia is anxiety or fear around the thought of going to bed. This must be sound unrealistic for you guys because sleep is indeed, and everyone needs to sleep to give our body rest. 3 important things that I would like to share and present with you guys is causes of somniphobia, symptoms of somniphobia, and treatment to treat somniphobia. So let's not wait any longer. Let's just go to the topic. Experts are not sure about the exact causes of somniphobia, but some sleep disorder could play a part in its development. Causes of somniphobia usually can be identified by tracking your sleep. The first thing that you can identify is when you have a sleep paralysis. So this sleep disorder occurs when you wake up from a rapid eye movement, REM, which when you wake up, your muscles being paralyzed. You can't even move your body. For example, you might experience nightmares that like hallucination during sleep. Next is nightmare disorder. Nightmare disorder can distress you throughout your day. Effect of vivid nightmares will make you feel like you're afraid and worry all the time, thinking about the nightmare will become true. The nightmare will become you will experience the nightmare in your real life. There is 2 obvious causes of somniphobia that everyone can face it every day, even if you notice or not. So now let's move on to the next point, which is symptoms of somniphobia. Somniphobia can cause a range of mental and physical symptoms. Mental health specific to somniphobia might include feeling fear and anxiety whenever you want to get to sleep or the bedtime is closer, so they will feel more anxious and more afraid. Did you know that that kind of feeling will lead them to staying up all night? Like they will not get to sleep because they're afraid if they fall asleep, they might experience nightmares that scare them. And they're going to think that something bad is going to happen to them, so they don't want to sleep. Individuals that have this somniphobia, you can see that they're always sweating, and then they have a problem of breathing. Also, they will face hyperventilation every time they're going to bed. So based on my points of symptom of somniphobia, now we know that somniphobia can really affect our daily life. So right now, I will explain about how to treat or what is the treatment, the best treatment to treat this somniphobia. Okay, the first type of treatment is exposure therapy, which is it may include in discussing fear and relaxing techniques, and then they will imagining how to get a good sleep. Other than that, they can try sleeping in a sleep lab, which is that the medical professional will stay awake during while you sleep, whether it is a nap or overnight. They will stay by your side. The second treatment is cognitive behavioral therapy. This approach help you to identify and work through your fear and anxiety. So you will discuss about this with your therapist and try to get a solution. The therapist may recommend to you getting a sleep restriction, which is you will be going to get a sleep and get up at a specific time, regardless how many hours you sleep, which is good for you because you now can get a sleep and without worries. The last method is medication. It is usually things that we give to a patient whenever they're sick. Beta blockers can help you decrease a physical anxiety, which is in illustration. I give example. It can help you minimize or maintain a steady heart rate, because whenever you feel anxious, your heart rate will be high up. They will rise up, and your blood pressure may go up too. So this beta blocker will help you reduce and maintain your heart rate and your blood pressure. The next one is benzodiazepines, which is a type of sedative that can help you through your anxiety symptoms. But this drug cannot be taken or used for a long time because you will get addicted to it. So normally doctors or therapists will just prescribe this type of drug when you really need it, when you in a serious anxiety. With all of my explanation, you all actually should have already picture of what is somniphobia and how to cope with this type of phobia. I have already explained about the causes of somniphobia, the symptom of somniphobia, and the last one is the treatment to treat somniphobia. Let me remind you guys, somniphobia is an intense fear of sleep that may prevent your body to get rest. If you have somniphobia, you're likely to experience physical health issues related to lack of sleep, along with anxiety and distress phobias usually cause. So I will end my talk here with a quote from Stephen Richards, which is, when you have mastered all of your fear, then you have mastered it all. And he also said that when you explore your fear, then only then you can set yourself free from anything. You need to overcome your fear, and you will see that you will grow and be a better version of yourself. So if you really have this somniphobia, I hope you can overcome it, and one or not, you need to do it. You can do it. Okay, thank you.